Assalamu alaikum guys. In this short video we'll talk about leukemia and its types. First of all, what is leukemia? Leukemias are actually malignant disorders of the hematopoietic cell compartment, which basically produce increased number of white blood cells in the bone marrow and in the peripheral blood. We basically in the normal hematopoiesis it is a stepwise process in which we produce red blood cells, white blood cells, lymphocytes, and the neutrophils, the basophils, and the eosinophils. So hematopoiesis is a stepwise process. So the cells basically they mature and then mature in the bone marrow, and then they are released in the circulation into the blood, right? So what is leukemia? As already said, that leukemias are malignant disorders of the hematopoietic stem cell, which will basically produce large number of white blood cells. And leukemias are of two types, right? One is the acute leukemia and one is the chronic leukemia. In the acute leukemia, we'll be having two types of acute leukemia. One is the acute myeloid leukemia and the other one is acute lymphoblastic leukemia, which we'll discuss in separate videos in further detail, right? So for now, what is hematopoiesis? Hematopoiesis is a stepwise process in which we produce what? In which we produce red blood cells, white blood cells, and lymphocytes. So the hematopoietic stem cell is present in the bone marrow. It can go on to produce myeloid stem cell, and it can also produce lymphoid stem cell. The myeloid stem cell will give rise to megakaryoblast, the monoblast, the erythroblast, and the myeloblast. And each one will produce its own types. For example, erythroblast will produce red blood cells, the megakaryocyte will produce megakaryoblast will produce megakaryocyte, which will produce, of course, what? Platelets. The monoblast will produce monocyte. The myeloblast is actually a very good one. It will produce a granulocyte. Granulocytes are of three types: the basophil, the eosinophil, and the basophil neutrophils, right? And the lymphoid lineage will produce B lymphocyte and T lymphocyte. B lymphocyte and T lymphocyte. T lymphocytes are of two types: CD4 positive and CD8 positive. We'll discuss this in separate videos. For now, come on to the acute leukemia. So what is acute leukemia? Acute leukemia is nothing but a neoplastic proliferation of the blast, which we say that the blast cells are actually greater than 20% in the bone marrow. Then we classify it into acute leukemia. Remember this word, that it is of the blast cell. The acute one is the blast one, and the chronic one will be the mature lymphocytes. So in acute myeloid leukemia, we have increased number of neoplastic blast cells in the bone marrow, and of course when it is present in such a large number in the bone marrow, it will also be spilled into the blood, right? And there will be the presence of large cells in the bone in the blood. So of course, when a large number of cells will be present in the blood, how will we know that whether it is myeloid or whether it is a lymphoblastic? So of course there are certain tests in which we can detect. In acute myeloid leukemia, in the myeloid one we'll have a myeloperoxidase positive. A chemical test will do which will confirm the presence of myeloperoxidase. It's very easy to remember, since it is acute myeloid leukemia, there is M and there is M. So in this way you will remember. Also sometimes these aggregates and produce or rods. It is like this. In the presence of or rods will confirm that it is acute myeloid leukemia. Whereas in acute lymphoblastic leukemia, we will be having what? We will be having a DNA polymerase positive. DNA polymerase, which one? TDT positive. This is the test to detect acute lymphoblastic leukemia. What is the test for acute myeloid leukemia? The myeloperoxidase positive and the presence of or rods in the cytoplasm, right? So when these blast cells will be present in such high numbers in the bone marrow, it will basically disrupt the normal hematopoiesis that is going on in the bone marrow. So we'll have anemia in this acute. We'll be having anemia, we'll be having bleeding, we'll be having infections. And these are due to certain reasons. Anemia will be because of the disruption of the erythroblast. The bleeding will be because of the platelets, and the infections will be because of the not presence of neutrophils. It's very easy to remember. So having said that, what is leukemia? Leukemia is the increased number of white blood cells in the bone marrow and in the blood, and it is of two types, acute and the chronic ones. The acute one will be having in the acute one will be having a neoplastic proliferation of the blast, and the blast will be greater than 20% in the bone marrow. And we also said that these increased number of blasts, the presence of increased number of blasts in the bone marrow will disrupt the normal hematopoiesis, and that will basically lead to anemia. What are the signs and symptoms of anemia? It is basically a separate domain. We will be talking about that in a different video. For now, just remember that anemia, we can basically diagnose anemia like patient will be having shortness of breath, he'll be having fatigue and dizziness, and there will be bleeding because of the thrombocytopenia, and there will be basically infections in the patient because of neutropenia. And the acute one, we said that it is of two types, the acute myeloid leukemia and acute lymphoblastic leukemia. I also told you that how will you basically differentiate between both of them in blood, because in blood there will be a presence of immature large cells. How will you know that whether it is a myeloid or it is a lymphoblastic? So there is a simple test. In acute myeloid leukemia, there is basically myeloperoxidase positive, and in acute lymphoblastic leukemia will be having a DNA polymerase TDT positive test, right? Simply. And then there is of course a chronic leukemia. There is chronic leukemia. We will not discuss this chronic leukemia right now. For now, just know that chronic leukemia is of mature cell proliferation of the mature presence of the mature lymphocyte, whereas the acute one is because of the immature cells, and the chronic one is mature cells. And the acute leukemias basically most commonly arise in children, whereas the chronic ones will be basically most often affects the large adults.